this video, I'll be discussing the various factors that help us to assess the difficulty of removal of an impacted third molar. When we want to assess the difficulty of removal of an impacted third molar, first we classify that impacted tooth based on a classification which is based on the clinical and radiographic findings of that tooth. So this is the first factor in assessing the difficulty. The second factor is the accessibility to that tooth. Third factor is the degree of the surgical exposure that will be required. Fourth factor is the ability to create a pathway for the tooth delivery. And the fifth factor is the ability to gain a purchase point to the tooth, whether that purchase point be created surgically or whether it is natural purchase point. So these are the five factors that govern or predict the difficulty of removal of an impacted third molar. First, we will discuss the classification systems of an impacted third molar that help us to assess the difficulty for its removal. The first system for the classification of an impacted third molar is based on the periapical or the more commonly panoramic radiographs, and it is based on the angulation of the third molar to the long axis of the second molar. The first one is and the most easiest considered impaction in case of lower third molars is the mesioangular impaction. It accounts for approximately 43% of all the mandibular impacted third molars. In this figure we can see it is an impacted third molar, lower third molar, which is mesioangular. Its long axis is mesially inclined with respect to the long axis of the second molar. The second impacted tooth that we encountered is the horizontal impaction. It accounts for approximately 3% of all the mandibular impactions. Here you can see a horizontal impactions. Third one is the vertical impaction, in which the long axis of the impacted tooth runs parallel to the long axis of the second molar. It accounts for approximately 38% of all mandibular impactions. You can appreciate this impacted third molar whose long axis is parallel to the long axis of the second molar. The fourth impaction is the distoangular impaction, in which the long axis of the third molar is distally inclined as compared to the long axis of the second molar. This is the most difficult lower third molar extraction because the path of delivery of this tooth is distally into the ramus, which requires much more removal of the bone. It accounts for approximately 6% of the mandibular impactions.